In this lesson, we will talk about medical issues that frequently contribute to falling. You know that older adults can have many medical problems, such as arthritis or dementia. But did you also know that many of these same medical problems can cause or contribute to falls? Let's discuss some of the biggest medical contributors to falling. Medications. Medical illnesses can lead to falls, but often the medications that a person takes to manage these, often chronic illnesses, can also increase the risk of falling. Being on 4 or more medications puts an individual at much greater risk of falling. The risk of falls is generally greatest in the first days or weeks after starting a new medication or increasing the dose of an existing medication. This holds true for over-the-counter medications too, not just prescription medications. What you can do. Take a look at their medicine list. If they are on more than 4 medications, including ones they take over the counter and not just prescription medications, and they haven't seen their doctor recently for a medication review, you may wish to suggest a visit. Be extra watchful anytime the older adult starts a new medication or increases the dose of one they already take. Some medications are more likely to cause falls than others. In particular, sleeping pills, anxiety medications, antipsychotics, some types of antidepressants, and blood pressure pills. If possible, discuss this with the older adult and contact their doctor to review these medications and determine if they are still needed. It could be that the medicines were needed at one time, but could now be safely discontinued. It is important to never stop or start any medication without first discussing it with their doctor. Memory problems. With mild to moderate memory problems, people may have an increased risk of falls because of an impaired ability to recognize and use common objects, for example, their cane or walker, and poor decision-making or overestimating their abilities. Dementia is a brain disease that causes permanent decline in an individual's ability to remember, reason, and manage their life. It begins with minor memory impairments, but is a slowly progressive, irreversible disease and is ultimately a terminal illness. At the end stages of dementia, there is severe physical impairment when people lose the ability to walk, talk, and eat. They often become incontinent of urine and stool. All of these factors drastically increase the chances that a person will fall. An older adult with confusion and behavior problems can be very difficult and frustrating for a caregiver, no matter how stressful though. Never use restraints or ties. Although you might think that tying the older adult's arms to their bed or chair would keep them from falling, studies have shown that people actually are more likely to get injured when using restraints. They become more restless and agitated and may even injure themselves. Just think about what you would do if you were being restrained. You'd try to break out. Restraints can also be considered a form of abuse, so avoid using them. Incontinence of bladder can also contribute to falls. When someone feels a sense of urgency because they have to relieve themselves, they tend to walk briskly rather than carefully. This increases the chance that they are going to fall. What you can do. Limit caffeine intake. Caffeine irritates the bladder and is a diuretic. It is found in coffee, tea, milk chocolate, and in many sodas. See if the older adult would consider switching to herbal tea. Even a little caffeine in the morning can lead to the need for frequent urination at night for an older adult. Make sure they have adequate fluid intake during the day, preferably water during the daytime. The elder's doctor can help guide exactly how much they need. Time toileting. Encourage the elder to go to the bathroom regularly. Start with every 2 hours during the daytime to keep the bladder empty and so prevent accidents. When frequent urination at night is a problem, discourage any fluids after 6 p.m. except sips of water with any medications. For men, you might want to leave a urinal on the bedside to avoid frequent bathroom trips. Parkinson's disease. Parkinson's disease causes issues with balance, especially when changing positions. For example, going from sitting to standing or starting and stopping walking. People with Parkinson's have stiff arms and legs, and so they are not able to correct their posture if they slip or trip. Older adults with Parkinson's also frequently have problems with sleep and may have auditory and visual hallucinations, meaning they may see or hear things that are not there. This can cause the older adult to try to walk or get out of bed unsafely and without help and could result in a fall. Individuals with Parkinson's disease also sometimes have memory problems or dementia, which we just discussed. Strokes. Strokes happen when the brain suffers an injury. They can cause significant mental and physical impairment, resulting in paralysis of the arms, legs, difficulty with speech, and difficulty with understanding what other people are saying. Sometimes, a person who has suffered the stroke and has some decreased strength may overestimate their own abilities and independence, which increases their chances of falls. Arthritis. As we age, it is not uncommon for our joints to suffer from wear and tear. This can cause deformities and often pain, which can lead the person to refrain from physical activity. Inactive or sedentary lifestyles lead to a higher chance of falls. This results in decreased muscle strength, which then increases risk of falls even more. What you can do. Exercising is important, so consult a physical therapist about incorporating exercises during the day to keep the older adult active while they're under your care. Discuss with the older client or notify their doctor if you feel pain is undertreated. Vision impairment. Individuals with vision impairment find dark rooms or low-lit rooms particularly challenging. Cataracts are the most common reason for vision impairment in older adults. What you can do? Encourage the older adult to make an appointment with an eye doctor if you sense that they are having vision problems. New glasses might need to be prescribed. If cataracts exist, discuss with the doctor about getting them removed. Studies show that removing the first cataract decreases the risk of falls. Diabetes. People with diabetes can fall for a number of reasons. Their blood sugar may be dropping too low. They may have neuropathy, which results in numbness in their legs and poor balance. What you can do, help them check their blood sugar using the method that their doctor recommends, and be particularly concerned about sugar levels that are too low. People with neuropathy need to ensure that they are wearing sturdy, supportive footwear, even in the house. Low vitamin D. 80% of people over the age of 65 have vitamin D deficiency. Vitamin D is very important for bone and muscle health. The bodies of older people produce less vitamin D. In addition, many frail older adults, especially those who already have trouble walking around, tend to stay indoors. As a result of this lack of exposure to sunlight, particularly in the winter, they have low vitamin D levels, which increases their risk of falls even more. What you can do? Take the older adult outside for a few minutes every day to give them regular exposure to sunlight. 20 minutes should be fine. We don't want to increase their risk for skin cancer. Increase their dietary intake of vitamin D from foods such as fatty fish like salmon or tuna, and milk, juice, or yogurt that has been fortified with vitamin D. Check with the elder's primary care doctor to see if a vitamin D supplement would be appropriate. Dehydration. It is very easy for older adults to experience dehydration. Older adults' bodies tend to get rid of fluids faster than can be replenished. Dehydration can cause a drop in blood pressure, and the resulting lightheadedness can then cause a fall. What can you do? Encourage the older adults to have a glass of water in the morning after they wake up and during each meal. This ensures that they stay well hydrated without causing more frequent urination and incontinence.